Hi everybody, I'm Dr. Selva, the Orthopaedic and Spine Surgeon at Beacon Hospital, and today we'll be talking about one of the treatment options for a spinal condition. I know most of you all think that the spine is the most dreaded surgeries that you all can go through, but actually with current technologies, current innovations, all these have come down to actually very minimally invasive, and it is not as frightening as what it used to be. The spine itself, as we can see from here, has got so many different components. For example, the bone, the disc, the spinal cord, nerves on either. In the neck, they go down to the arms, and in the lower back, it goes down to the legs. Joints that move all separately on their own, muscles, ligaments, and so many structures. So of course, there are so many different conditions for the bones like osteomyelitis, osteoporosis, fractures, for the discs, disc prolapse, disc infections, for the nerve compressions, joint arthropathies. There's so many different conditions. When the patient comes in, we will normally go through a history of what's basically happening, and then a clinical examination, and we will come to a diagnosis. Once we have come to a diagnosis, we would then probably need to reconfirm that diagnosis, which we may need a little bit more of investigations like an MRI. And once we get the MRI, we will be able to tell you for sure where this problem is arising from and how to treat it. Most of the time, the treatment would be conservative: medication, rest, exercise, physiotherapy, and so on. But in some patients, they do not respond well to that. So they may need further management, which will come in forms of surgery. Of course, when they say spinal surgery, everyone is dreading that because they think that you have to cut open, sometimes even put screws, bleeding, months and months of recovery, and they do not get well back. But now with current technology, we have improved so much on that, and the surgeries are very minimally invasive. Recovery is very fast, and the results are also very, very good. Like some of the surgeries, like open surgery, they have now gone and then they changed it to total disc replacements, take out the whole disc and replace it. They've gone to minimally invasive to endoscopic discectomies, nucleoplasties, annuloplasties, and so on. Now what we will do today is we will discuss on what we practice here, which is nucleoplasty. Nucleoplasty is a minimally invasive procedure that is used for slip disc or disc prolapse. In Chinese they call it Kwachi. In Tamil they call it Javu Vitrukku. The condition is the disc has come out. Once the disc comes out, the nearest structure to it is a nerve, and this disc will press onto that nerve. And depending on how much it presses onto that nerve, the symptoms may be very different. For example, if there's only little bit gentle pressure onto that nerve, you may have pins and needles, tingling, or you may have a little bit of heaviness, a bit of weakness, a bit of numbness, or you may have pain. So the problem is the disc is pressing onto that nerve. And in nucleoplasty is we shrink the disc so that compression does not happen. So we take a small probe, and that probe goes into the disc, and we use radio frequency and we burn off the disc. So once you burn off the disc, that area becomes empty, the front, that the whole disc will shrink, but everything else is kept intact. The hole is so small that it will just close up within a few days, and everything else becomes functional as what it used to be. How long does it take us to do this procedure? It takes us about 30 minutes to 40 minutes to do the whole procedure. Sometimes we do the procedures in the morning and we send the patient back in the evening. Occasionally we keep them overnight so that we can observe the patients, and then we can also give them antibiotics to cover them for the day before we discharge them with oral antibiotics. One more question that you might want to ask, that at what age can we do this procedure? Actually, this procedure can be done for even very young people, as young as 17, 18 years old, who have disc problems, or they can be done for anyone even in the 80s. My oldest patient was 92 years old. He underwent a surgery and he lived to be more than 100 years old. Who have got other conditions, who actually can't undergo long surgeries, where do they turn to? This is one procedure that can definitely help them. Most of the time, The patient is dreadful of the whole spinal procedure. It's going to be very painful. They're not going to be able to get up and walk. They're not going to do so many things. Actually, we do it not under general anesthesia, we do it under sedation. It means we just put you to sleep. It's like taking a sleeping tablet, but then we inject it. So you go to sleep and you'll sleep throughout. You won't feel anything while we're doing the procedure. Most of the time it doesn't. You don't feel anything. And then once you get up, it's like you're coming out of a deep sleep. You are more conscious from the deep sleep. You can immediately get up and start walking. You can walk to the toilet, you can sit down, you can sit out of bed. Everything can be done as like what you normally used to do. So the limitation in this procedure is very, very, very minimal. Will there be any complications? Yes, they can be. But the chances of that complication happening in this surgery are very, very, very minimal. Yes, of course, now you know a little bit about nucleoplasties. You can go and Google this. You can check that out for yourself also. Who are those who actually would need to come and see us if they have a problem? Those who have got backaches. Usually, normally backaches within a few days if it stops. But if it does not stop and it goes on for months, then those people may need to come and have a consultation with a spine surgeon. Those who have pain going down their legs and those who have difficulty in walking, these are the ones who have actually a disc problem. You can have back problem and it could be from any other structures, but if it goes down your legs or it goes down your arms and it becomes numb or it becomes painful, then it is towards more of a disc problem which you would need to go and sort it out. And what the technology now says that don't wait too long. When it's something small, do something small and finish it. Go and check it out first. If it's not really bad, the doctor will advise you, yes, you don't have to go and do surgery. But if it is, then they may advise, and nucleoplasty is one of the best things that may benefit you. All the best. And of course, if anyone needs further information, you can also visit our Beacon Hospital website, or you can call in for more information and get an appointment to see one of us.